For my proposal, I am promoting a policy called the Teenage Pregnancy Parenting Prevention and Support Act of 2016 that will decline the rates of teenage pregnancy in the United States through prevention, support, and sex education. There is a long history of policies that are related to reducing teenage pregnancy in the United States. Teen pregnancy began to catch a lot of attention during the 1950s and 60s, and it is during this time when it became identified to be a major social problem. In 1965, as a part of Lyndon Johnson's War on Poverty, he provided funding for birth control to low-income families. In 1970, Title X was passed and became a law as part of the Public Health Service Act. Title X is the only federal grant program solely dedicated to providing individuals with comprehensive family planning and related preventive health services. In 1995, during President Bill Clinton's State of the Union address, he singled out teen pregnancy as our most serious social problem. On September 30, 2010, the U.S. Department of Health and Human Services approved $155 million in new funding for comprehensive sex education programs designed to prevent teen pregnancy. Adolescent pregnancy and parenthood are closely associated with a host of social and economic issues that affect not only the teens, their children, but the society as a whole. Teenage mothers are less likely to go to high school and finish high school, and are more likely to live in poverty, depend on public assistance, and be in poor health. According to the Campaign to Prevent Teen and Unplanned Pregnancy, the annual public cost of teen childbearing is nearly $9.4 billion, which is why my policy proposal is created. I am promoting sex education that starts at a younger age, more attention and emphasis on teens who are in the welfare and foster care systems, and create schools and daycares for teenage mothers. There is data that states that sex education is too little and too late. By the time sex education is beginning to be discussed, teenagers are already engaging in sexual and risky behaviors. So this policy promotes that sex education should begin in the 4th grade and continue every year until graduation. This will give children and teenagers more information and knowledge about the risk and consequences of engaging in risky and sexual behaviors. Rates of teenage pregnancy are far higher among youth in foster care. Teenage girls who are in the foster care system are more than twice as likely to become pregnant than a teen who is not in foster care. My policy would give more money to the foster care system to help care for these teenage mothers and to help train people who work with foster care youth to teach them about sex. By focusing on training of caseworkers, child welfare agencies, and foster care parents, it would go a long way towards addressing sexual and reproductive health needs of foster youth. Researchers have found that there is a strong relationship between adolescents and their parents or caregiving adults such as foster parents that is critical to helping youth avoid teen pregnancy as well as other risky behaviors. The teenage pregnancy and birth are significant contributors to high school dropouts. Only 50% of teenage mothers receive a high school diploma by the age of 22. So the third goal of my proposal is to create schools specifically for teenage mothers and more daycares in high school. This way mothers have an option of continuing to go to school and will not have to drop out. They could bring their child to school with them, and they would not have to depend on their parents or grandparents to provide child care, and they don't have to pay out of pocket for child care. This will take a lot of funding and convincing of people, but I believe enough people think that it is necessary to save teen mothers from dropping out of high school. This proportion of my policy proposal could possibly be critiqued due to the lack of scientific evidence supporting that daycares and schools will decline the rates of teen pregnancy. We all know that teenage mothers are very likely to drop out of high school, but there is not a lot of evidence that supports daycares or schools specifically for teenage mothers. To convince people that this is a good idea, I will get funding to create one school specifically for teenage mothers and put a couple different daycares in a couple different schools and prove that it will keep mothers in school. Hopefully, by proving schools and daycares will help to decline the rate of high school dropouts, I'll receive more funding to create more. This is just a stepping stone in the right direction to stop the high school dropout rate for teenage mothers. Even though teenage pregnancy rates have been declining for years now, it is still a major social problem, and a lot of people believe that. The United States still has the highest rate among comparable countries. By putting this policy proposal into action, the teenage pregnancy rate will continue to decline at a rapid pace. We need to end the cycle of teenage pregnancy, and I promise you that this proposal will do that. So thank you for listening, and go vote for it.